She had been on thyroid medication for 11 years. Same pill, same dose, same time every morning. Then her TH numbers started drifting. Her doctor increased the dose, then increased it again. She was more tired than ever. Her hair was thinning. She was cold in rooms where other people were comfortable. Classic signs that the thyroid hormone was not reaching adequate levels. Her dose had tripled over 2 years, and her doctor could not explain why, until a nurse practitioner at her clinic asked her one question: "What do you do in the 15 minutes after you take your pill?" She thought about it. She made coffee with milk. She had a glass of orange juice. She took a calcium supplement, all within the same 10 minutes as swallowing her medication, every single morning, for 11 years. If you take levothyroxine sold as Synthroid, Tirosint, or Euthyrox, you are not alone. It is the third most prescribed medication in the United States, with more than 80 million prescriptions written every year, and it is one of the most quietly misused medications in senior health. Not because people are careless, but because no one explains what happens in the 30 to 60 minutes after you take it. By the end of this video, you are going to understand exactly how your thyroid medication gets absorbed, which common morning foods and drinks block that absorption significantly, and the simple timing protocol that can make your current dose work the way it was always supposed to. Here is what you need to know about how this medication actually works. Your thyroid gland produces hormones that regulate almost everything: your energy levels, your metabolism, your body temperature, your heart rate, your mood, and your hair and skin health. When your thyroid does not produce enough of these hormones, a condition called hypothyroidism levothyroxine replaces what the gland is missing. Your doctor calculated your dose using a blood test called T-She thyroid stimulating hormone. The goal is to keep that number in a precise therapeutic range. But here is what makes levothyroxine genuinely unusual among common medications. It is extremely sensitive to interference at the point of absorption. The drug must be absorbed through your gastrointestinal tract in a very specific chemical environment. If that environment is disturbed by certain foods, drinks, or supplements, the medication does not get through properly. It is not metabolized differently later. It is not partially compensated for elsewhere. What does not absorb correctly in that window is simply lost. A systematic review published in the journal Pharmaceuticals compiled the evidence on every food and drink known to interfere with levothyroxine absorption. The findings were consistent and significant. And the most common offenders are not exotic supplements or unusual foods. They are things that most seniors with thyroid conditions consume every single morning. Let me walk you through them. Coffee. A study published in the Journal of Clinical Endocrinology and Metabolism found that taking levothyroxine with or immediately after coffee reduced absorption by 27 to 36%. Not a small margin, not a rounding error, up to a third of every dose. Gone, the mechanism is not caffeine. This is important. Decaffeinated coffee produces essentially the same reduction. It is the coffee itself, its tannins, and the way it alters the gastrointestinal environment that interferes with absorption. The FDA labeling for levothyroxine specifically instructs patients to take it on an empty stomach, with water only, at least 30 to 60 minutes before consuming food, coffee, or other beverages. Most people with thyroid conditions have heard take it in the morning. Very few have heard the 30 to 60 minute window that follows. Milk, a pharmacokinetic study published in the journal Thyroid, specifically examined what happens when levothyroxine is taken with 12 ounces of cow's milk simultaneously. Researchers measured TH and thyroxine levels at multiple points over 6 hours after ingestion. Milk reduced levothyroxine bioavailability significantly. The researchers concluded that the effect was likely attributable to the calcium and protein content of the milk, both of which bind to the medication and prevent it from being absorbed. 1 glass of milk with your morning pill, and a meaningful portion of your dose does not reach your bloodstream. This matters especially for seniors who are often encouraged to increase their calcium intake for bone health. Calcium supplements taken too close to levothyroxine produce the same binding effect as dairy. The recommendation from the American Thyroid Association and the FDA labeling is clear. Calcium supplements should be taken at least 4 hours apart from levothyroxine. Iron supplements. Iron binds to levothyroxine in the gastrointestinal tract through the same mechanism as calcium. Studies show that concurrent iron supplementation can reduce levothyroxine absorption by roughly 40%. Many seniors over 60 take iron supplements often recommended for anemia or general health. Taking both at the same time, even occasionally, can meaningfully impair thyroid hormone levels. Iron supplements should be separated from levothyroxine by at least 4 hours. High-fiber foods brand cereals, high-fiber breads, certain whole grains also reduce absorption, though to a lesser degree. The fiber physically binds to the medication in the gut, carrying some of it out before it can be absorbed. This does not mean seniors on levothyroxine should avoid fiber. Fiber is important for gut health, blood sugar, and cardiovascular health. It means that the window between taking the medication and eating a fiber-rich breakfast matters. Before I give you the specific protocol, I want to be clear about something important. If your thyroid levels have been unstable and you have been doing any of the things I just described, do not adjust your medication yourself. Bring this information to your doctor. Because if your dose was increased while your absorption was being impaired, correctly absorbing the same dose now could put your levels too high. Your doctor will likely want to recheck your TSH. That is not a problem. That is progress. What I am about to give you now is the protocol that allows your medication to do exactly what it was prescribed to do. Here is the correct morning sequence for anyone on levothyroxine. Step 1. Wake up. Before anything else, before coffee, before juice, before food, take your levothyroxine with a full glass of plain water. Not sparkling water, not water with lemon, plain water. That is the only thing that does not interfere. Step 2. Wait. The FDA recommends waiting at least 30 to 60 minutes before eating or drinking anything other than water. Many endocrinologists recommend 60 minutes for maximum absorption. 30 minutes is the clinical minimum. Your specific situation may vary. Ask your doctor which window they recommend. During that window, no coffee, no tea, no juice, no milk, no food. Just time. Step 3. Separate your supplements. If you take calcium, iron, magnesium, or antacids, all of which can interfere with levothyroxine, take them at a completely different time of day. Midday or evening is ideal, at least 4 hours from your thyroid medication. Step 4. Make this consistent. Your TH level and your dose calculation are based on a consistent absorption pattern. Even 1 or 2 days a week of inconsistent timing can introduce enough variability to affect your levels. The goal is not perfection once, it is the same protocol every morning. Let me show you what a thyroid safe morning actually looks like. You wake up, fill with water. Set a timer for 60 minutes if that helps. During that hour, you can shower, get dressed, read, do light stretches. What you cannot do is eat or drink anything other than water. After 60 minutes, your coffee is now safe. Your breakfast is now safe. Your orange juice with breakfast is fine. Your yogurt, eggs, oatmeal, all fine. The only things that still need to wait 4 hours longer are calcium supplements, iron supplements, antacids with aluminum or magnesium, and certain other medications your doctor may have flagged. Everything else, after 60 minutes, is yours. Here is the one sentence that matters most from this video. Levothyroxine must be taken with plain water on an empty stomach, followed by 30 to 60 minutes before eating or drinking anything else, because coffee, milk, calcium, iron, and high fiber foods all meaningfully reduce how much of the medication your body actually absorbs. You may have been doing everything your doctor asked, taking the pill every morning, never missing a dose, and still not absorbing the medication the way it was designed to work. That is not your fault. This information is simply not explained at most pharmacy windows. It is not on most prescription labels. And the average 11-minute doctor's appointment does not leave room for a conversation about what happens after you leave with that prescription. Now you have it. One small change to your morning routine. The same medication, the same dose, working the way it was always meant to. That is what this channel is here for every single week. Not fear, just the specific truth your doctor didn't have time to explain. If this helped you today, subscribe. Every week I bring you one thing that makes your good health decisions even better. Before you go, we have spent 5 videos on food-medication interactions, muscle nutrition, and what your doctor didn't have time to explain. Next week, I'm stepping back from medication entirely because there are 5 foods that research now links to meaningfully reduced cognitive decline in adults over 60. Not supplements, not prescriptions, actual foods available at any grocery store, affordable for any budget. And one of them, the one with the strongest published evidence, is something most seniors in the United States eat less than once a week. Most people think brain health after 60 is about avoiding bad things. Next week, I'm going to show you it is mostly about adding one right thing. That is next week. Don't miss it.